My PhD is going to be looking at the genetic mechanisms of colorectal polyposis. So patients who've got lots and lots of polyps throughout their large bowel, and we're looking at those patients to try and work out what genetic mutations they might have that's causing their disease.
I was very attracted to the idea that I could include research training as part of my training whilst doing my clinical speciality. I like the fact that I would have a varied week. I'd have days where I would be still learning my clinical work, but also have days where I'm understanding how to do research and also doing meaningful research. Doing a PhD means that you're not just a name on a paper of some work that somebody else is doing. It means that you're leading your own work and you're making your own decisions and planning your own research, and that's really very appealing.
I applied for the WCAT scheme because it's an amazing opportunity really to mix clinical and research training, and it's obviously a run-through job to consultant level, giving you time to develop your academic interests. It's also based in Wales, which would allow me to go to Cardiff, which is an area, a centre that is really, world class for what I want to look at. So.
After WCAT, I'd like to still be in Swansea, hopefully with my own research lab, looking again at Barrett's esophagus in particular, and other upper GI cancers, hopefully then trying to establish some good treatment therapies for these patients.
I think the WCAT scheme is a really great opportunity for people who are interested in research but want to maintain clinical training as well. And I was appointed in the second year of training, so I have been around for a little while now, and I think it's a really good opportunity, and it's also a really flexible opportunity, and depending on what your research needs are, you can make it work for you, and I think that's really helpful. I think it's really unusual to have such a degree of autonomy over your own training.
It's pretty much unrivaled. It certainly offers a really good opportunity for funding and parallel clinical and academic training, and it's ideally suited for doctors with a research interest who not only want to do research but want to continue doing research in the future together with a successful clinical career.
I think it's been an excellent scheme. I think it's been really well supported, really well structured and organised, and the opportunity to work with some of the world leaders, for which Cardiff University is known, has been really important to my future career.